Africa's top public health official, says that the period of using severe lockdowns as a primary pandemic response tool is over. Nkengasong, the director of the Africa CDC, says that these lockdowns are no longer the best way to contain COVID. Instead, Africa CDC is calling for the use of a range of public health and social measures as vaccination rates gradually rise across the continent. Right now, over 321 million vaccines have been administered across Africa. Under 10% of Africans are fully vaccinated. Nkengasong also praised South Africa for adopting a data-driven response to its latest infection wave. South Africa experienced a very steep rise in COVID-19 infections from late November, around the time it alerted the world to the Omicron variant of COVID. That wave peaked in mid-December, and the government there did not resort to strict restrictions as it had done in previous waves.
We are very encouraged with what we saw in South Africa during this period, where they look at the data in terms of severity, and they actually did what we're encouraging countries to do, to really say that the period where we were using lockdown as a tool, severe lockdown as a tool, is over. We should actually be looking at how we use public health and social measures more carefully and in a balanced way as the vaccination increases. Unless and until by the end of this year, the continent actually scale up its vaccination to above 70 or 80%, my worry is that we might actually be at the end of this year into a scenario where COVID becomes endemic.
So let's explore that in a bit more detail. Anthony Mveyange is the Executive Director of the Partnership for African Social and Governance Research. He joins us now live on the program. So severe lockdowns do come with an unacceptably high economic cost, but what should policymakers be doing in its place?
Oh, thank you very much. I think there are a few things that policymakers can pay attention to. Allow me to mention a few. One is strengthening public and health and social measures. And here we're looking at things, how do they do vaccines, for example, access to remote areas? How do we increase awareness to talk about the need for public to understand and appreciate the urgency for vaccination, access to COVID-19 and its logistics, testing, mass testing particularly, very important, a quick turnaround. So that's one area to think about. There could also be rooms for technological innovation to think about, and we are looking at lockdown more broadly here, not necessarily because of the COVID vaccination, but also to think about the remote working, schooling, and how do we help public health, public schools to actually function and not to impose lockdown. We are talking about businesses for SMEs, e-commerce, how do we support them? How do we build the infrastructure that is needed? How do we build the right connectivity that is needed? And how do we make these access to these infrastructure and connectivity affordable for common citizens to be able to access them? But most importantly is actually to demystify the COVID vaccine hesitance.
Let's dig into that in a bit more detail, because you mentioned awareness in your initial response. Have governments done enough? Are they doing enough, especially in the last year, to essentially say, look, we need this vaccination for this specific purpose. It is safe, it is effective, because we're seeing a lot of misinformation flying around in WhatsApp groups, especially up and down the continent. Are governments doing enough to counter it?
Yes, so I think there's so much information, and I like what the way you use, misinformation. And I think how do we then build the trust? I think the challenges that African governments have been facing is how do you build the trust in the era of misinformation? Whatever is coming around from whether the government, from outside. So I think credibility of the information that is being shared is very, very critical. And if this information is coming from the sources that people trust is very key. And that is when we can think about people accepting, because as you rightly said, misinformation misguide people. But how can government counter such misinformation? By having credible sources of information that are coming from credible sources and authorities within the government machinery. That is key. And to avoid what we have seen in Africa, a lot of nuances across the different countries. How do we speak as one? How do we bring the different experiences from the different countries in terms of how information is shared, in terms of how information is consumed by the public, and how does the government speak in unison to address some of the misinformation?
But just along those specific lines, because some of the things that we're seeing now is that, you know, the whole idea of vaccination tends to be approached in a very heavy-handed manner. It's government saying you must get vaccinated, that's it, no discussion around it. You're seeing policies coming through making vaccination mandatory. But is that really the best way of getting more and more people vaccinated, especially in an environment where there's low trust between citizens on one hand and policymakers and governments that have really not been investing in public health care for decades? If policymakers are going to show up and say you must get vaccinated, they're going to run into resistance.
Of course, they will. They will. I think it needs to public dialogues at the lower level, the community level, for people to buy in. We have had other vaccines in Africa. We have had cholera vaccines. We have had yellow fever vaccines, and people take their kids for vaccines. But why is it so easy for parents, for example, to allow their children to be vaccinated, but it's very difficult for them to go for COVID vaccines? I think it has to do with it's a process. It's not a one thing you can just hand it down and say, hey, today we want you to vaccine. It's a process to engage. The government need to engage the citizens. They need to understand what are the benefits of being vaccinated. Why is it important? And given the misinformation, given the fact that some of these vaccines are associated with some side effects, the government has a duty, the governments have a duty to actually enlighten the citizens and say, these are the benefits, these are the disadvantages of being vaccinated. What does it mean for your community? What does it mean for your people? And engage the citizen. Because in the end, it's not about what the government wants, it's about the people. Even the government themselves, they are people. It's not like government is a machinery. So they are people. You just need to convince the people, the same way politicians are able to convince people, vote for me. So you need to have an agenda. You need to have a very clearly articulated proposal. Why is it important for citizens to actually be vaccinated?
Right.
What are the benefits for the country? What are the benefits for the individuals?
Okay, one last question for you because I'm running out of time here. But the latest data that I've looked at from the Africa CDC shows that we've used up nearly 60% of the total vaccine supplies that we've acquired pretty much across the continent. You've covered some of the vaccine hesitancy factors, explaining some of that slow uptake. But what else are the problems in getting a lot more of these vaccinations into the arms of millions across Africa?
Yes, I mean, I'll categorize into two categories. One, the demand side, the hesitance, the trust, the social norms that we talked about. But I think the most important is the supply side, the infrastructure that is needed to map where the vaccine is needed. Most of the Africans are in remote areas. So far, the focus has mainly been in urban areas. What about the remote areas that cannot be easily accessed? Do government have the infrastructure that is needed to be able to access the logistics that are needed for these vaccines to reach many people? Okay, what about the technology on the supply side? Can the government invent new ways of thinking and doing things to actually reach out to majority of Africans who cannot access these vaccines easily? So I think the focus should be pivoted towards the rural areas where majority of Africans are, where infrastructure is challenging, logistics are challenging. If these are addressed together with the demand side interventions, I think we will get something positive.
All right, we'll leave it there for the time being. Anthony Mveyange, the Executive Director of the Partnership for African Social and Governance Research, thank you very much for your time this evening.